In this video, we'll talk about retrograde pyelography. Here, the patient is made to lie in the 15 degrees head down position and the general anesthesia is given. So, after giving the general anesthesia, we'll pass the cystoscope, and through the cystoscope, we'll pass the catheter. See what is happening here. So, suppose this is the penis and this is the urethra. First, you'll pass the cystoscope. So, this blue color one, this number 1 is the cystoscope, and through the cystoscope, this green color one is a catheter. So you'll pass through the cystoscope, you'll pass the catheter through the cystoscope. So this green color, second one is a catheter. So what are you doing? In the urethra, first you'll pass the cystoscope, and through the cystoscope you will be passing catheter. Now what will you do? You'll inject a dye which is called as sodium diatrizoate dye, and now you'll take the X-ray. So what is the advantages of this retrograde pyelography? You can take this breast border biopsy, and also better anatomy visualized, and selective urinary sample can be taken before starting this procedure. So what do you mean by breast biopsy? So in this procedure you are introducing cystoscope, right? So from wherever you want you can take the biopsy. So that is breast biopsy. Also better anatomy is visualized because here you are directly injecting the dye into the urethra, right? So that's why. And coming to the disadvantages, it can be because of the general anesthesia and it is an OT procedure, so it can be disadvantage to the patient. And coming to the indications, where will you use this retrograde pyelography? If you fail to get any examination findings in the IVU, so failure of showing any results from the IVU greater than 72 hours, and also if there is any urinary tuberculosis or any tumors from the renal pelvis, right? So these are the indications for retrograde pyelography. So here in the picture you can see the patient is lied down in the 15 degrees head down position. General anesthesia is given. Through the urethra they are passing cystoscope, and through the cystoscope they are passing catheter. So even in this picture you can see a cystoscope is passed through the urethra, and through the cystoscope they will be passing catheter. So these are the X-ray which is taken after injecting this dye. What dye will you use? Sodium diatrizoate, right? So this is about it. Bye.